Hi, my name's Garrett. I'm one of the 19 Iowa students spending the year here in Des Moines. I've been asked to talk a little bit about the pediatric rotation. So the way the pediatric rotation is set up is divided into 2 3-week blocks. You'll first start out with 3 weeks of inpatient and you do 3 weeks of outpatient peds. On inpatient, the way the day is set up, you start out in the morning about 7 o'clock and you meet up with the whole team, all the students, all the residents, you get together and you get presented to what happened overnight from the residents who stay on overnight. That takes about a half hour, and then you have a half hour depending on what day it is. There'll be certain days where an attending will come in, you'll do trivia games, or you'll go down to a lecture hall and get a quick talk from an attending or a visiting speaker or one of the specialists. Very informative, very laid back, relaxed, at breakfast. After that, everybody kind of splits off. You get your patients assigned to you. You'll go pre-round, you go see the patients by yourself. You'll write the note in the chart, stays in the chart, and the residents will go over the note with you and give you feedback, let you know what needs to be changed, and you really get the hang of things, and things start going smoothly after the first couple days. It's a lot of fun. After that, the attendings come down about 10 o'clock. We meet with the attendings, round on our patients, and then once you get to our patients, you present directly to the attending, let them know what's been going on, and the attending will ask you, what do you think's going on with this patient, how should we treat them? And then they'll give you feedback, or they'll ask you certain questions. It's very, very informal, very relaxed. Great attendings. They're a lot of fun. They're very funny. And then you'll go in and see the patient with the team and the attending. That goes for about 10 till about noon, and then you go for lunch, where you'll have a noon conference, hang out with the residents, have lunch, get a talk from a resident or an attending or a visiting speaker again. The afternoons are very laid back. There's a lot of free time. What you basically do is sit around, wait for admits to come in, and you can come in, do the full admit with the new patient coming in, do the full H&P, get a lot of autonomy, and then you write the note, and the resident will go over that with you again. So that was the inpatient, and I would say the biggest strength of inpatient is just the attendings are great, funny, love to teach, and it's very it's not intimidating at all. If you say something wrong, it's not a big deal. They'll tell you why it's wrong, and then kind of just help you teach through why things are the way they are. So after inpatient, I went to outpatient. Outpatients, again, you work in one-on-one with an attending. So you'll go in, you'll do the well child check, you'll do the physical exam, whatever needs to be done, and then you come back out, you present to the attending, and they'll kind of ask you what's going on, diagnosis, treatment, and then you'll go in together. They'll do basically the same thing, and then you come back out, and they'll give you feedback on how you did, what you think's going on, if you were right, treatment plans. Then you kind of just discuss that for a while. Again, great attendings, love to teach it, and it's just great working one-on-one with these great faculty members. I really enjoyed my pediatric rotation, and I really hope you'll consider coming to Des Moines and trying it as well. Thanks.